back to the Tooth Doctor YouTube channel. We're so glad that you joined us. This is Dr. Peter Yoo from the Tooth Doctor. And today we're going to be talking about gum disease facts. So Martin H. Fisher has said that if a patient cannot clean his teeth, no dentist can clean them for him.
Except my kids.
That's funny. The CDC says that periodontal disease increases with age and that just over 70% of adults 65 years and older have periodontal disease.
Okay.
Yeah.
That's pretty good. I thought it was like 80%, but so yeah, whatever.
And gum disease is one of the biggest threats to dental health. With proper oral hygiene and visits to the dentist regularly, it can be prevented.
I agree.
Of course, right? Yeah.
Yeah.
Makes sense. So let's break it down. What is gum disease exactly?
Basically, gum disease is when, let's say you have a cut on your skin. Okay? Well, the area is injured and your body is trying to clean that area by itself, right? Back in the day, we didn't have polysporin. We didn't have sometimes antibiotics. So your body has its own mechanism to try and fix that. So gum disease is actually, it's almost like counterintuitive. It's when you have plaque and tartar on your teeth, it's a foreign object, okay? Oh, here we go. When you get like a sliver, okay, it hurts. Why does it hurt? Well, because it's something that's not part of your body, that's inside of you, and your body's trying to get rid of it. Right? So when you have a sliver, sometimes it takes a while to go in and pull that piece out. So gum disease, when you have tartar and plaque that gets around your gums, your body doesn't like it. So it's actually trying to get rid of it. But the only way you can is you have to brush it off, clean it off. What your body actually does is it starts attacking that area. It actually starts attacking your own gums. And that's where your gums actually become sensitive and they start to bleed and they hurt when you touch them or brush them.
Yeah.
Like that. Yeah.
Okay. So you've kind of already broken it down, but do you have anything else to add to what causes periodontal disease?
So periodontal disease is bone disease.
Oh, it's different than
Yes,
gum.
it is very different. So gum disease is what you see, the pink stuff.
Right.
Periodontal disease is actually a disease that affects the bone that's supporting the teeth.
Okay.
Okay.
So what would cause that disease?
Same thing, plaque, tartar, as it damages the gums are kind of like the Ziploc seal. Okay? So if you don't take care of it, then the Ziploc seal opens up and then germs and stuff get inside the gums and then they get close to the bone. Okay? And that's where periodontal disease begins, is bacteria gets close to the bone, your body again is trying to fight it off, but what it ends up doing is your body actually starts attacking, damaging the bone around itself, and that's how you start losing, getting bone loss.
Right.
Right?
Gotcha. What are some symptoms of gum disease?
Gum disease: bleeding,
Okay.
swelling. Sometimes, like your gums will start, we call hyperplasia, or basically just they grow. Okay. Sometimes gum disease is, did I say redness, swelling?
Yeah.
Yeah.
You have those, yeah. Yeah, sounds like it. What are the biggest dangers of periodontal disease?
The biggest danger is you lose your teeth.
Right.
Right? So periodontal disease, you're gonna basically not have good support, and then the ultimate result is that teeth will actually start shifting. I've seen some people where they've had periodontal disease and their teeth have actually kind of grown out of the bone, and they have what we call a snaggle tooth. Okay. Periodontal disease is also related to other health concerns, related to heart disease, diabetes, and they say your mouth is kind of the entrance to good things and bad things, right? So if you're not taking care of your mouth, there can lead to other bacteria getting into your system, which can affect other parts of your body.
Wow. So who is susceptible to gum disease?
Everyone. Everyone is susceptible to gum disease.
Okay.
If you eat food, you're susceptible. Okay?
Makes sense. What are some of the risk factors that increase the likelihood of gum disease?
You know, obviously the types of foods that we have, some nutrition, right? So it's we talk about having good balanced meals and having proper foods. Sometimes it's certain types of foods that you eat, sticky foods, things like that get stuck between your teeth. It increases your likelihood of gum disease. And most importantly is the brushing, right? If you don't clean the plaque off, you're not brushing properly, twice a day, 2 minutes a day, then your gum disease will increase.
Okay. Is there anything else that we can do to prevent gum disease, like brushing, obviously twice a day, 2 minutes?
Brushing, all those things that you hear, brushing twice a day, it's very important because the whole idea is that the plaque, when it sits onto your teeth, they actually mature. The bacteria actually matures. We have a lifespan. If I say how long does it take for a person to become an adult? Usually people say 18, right? 18 years. Yeah. That's when you're officially an adult. Well, bacteria, it's 1 day. Okay, so a baby germ goes to an adult germ in 24 hours. So the reason we brush twice a day is to stop them from turning into adult germs and preventing that cycle.
Yeah.
Right?
Wow, okay. Well,
that's why brushing once a day is not good enough. Once a day, people get more plaque, more risk of gum disease. I tell patients, if you brush once a day, on average, people that brush a day get anywhere from 4 to 10 cavities. People that brush twice a day, on average, it's usually between 1 and 5 cavities. Wow. Right? So it's much less from cavity standpoint and even gum disease.
That's motivating for sure. Is surgery always necessary in gum disease cases?
You get some cases where you'll get bone loss, you get some recession, and those are times when surgery is necessary in order to try and fix and heal those. But a lot of times we can do non-invasive. We don't have to do actual surgery and any, in a sense, cutting. But if we go in and do some scaling and deep cleaning, there are times when things will be healed, the bacteria is removed, and the bone can heal. I've had a number of patients, actually some close friends of mine. One close friend had a tooth that was loose. He was dangling, and he's like, I don't want to lose that tooth, or I'm gonna have to wear a denture or get a bridge or something. And so that was a big scare. And so I told the person, hey, we need to make sure we keep the area clean. I actually did give him some freezing, and we went and did a deep cleaning, cleaned out the germs, the build up, the tartar, and told the patient, I want to see you back in a month. Had a look, I want to see you back in another month. Had a look, and everything had healed back. The bone actually grew back about 3-4 millimeters. Wow. Again, not everybody, don't call me Dr. Yoo says you can grow back bone. That's not the case, but that was a situation where everything was healed, the bone actually hardened around the tooth, and the tooth was solid again. Wow. And we did the proper treatment so that that person could keep their tooth, and now they don't have to wear a denture or get an implant, things like that.
Yeah, that's great. Is there any way to reverse periodontal disease?
Yes. Come to the tooth doctor. Okay. Hygiene maintenance is very important. We get patients that come in every 3 months. I had a lady that came to see me about 5 years ago. She had some crowded teeth, she had a bunch of loose teeth, and I looked at her, I was like, oh my goodness, there's so many loose teeth. I told her, your first option is pull out all your teeth and get top denture, bottom denture. And she's like, no. I don't want to do that. So I said, okay, well, option 2 is we pull out some of your teeth and then we'll make you a partial denture. Okay, so you keep some of your teeth. I was thinking, okay, she had about 30 teeth, and she probably needs to take out about 10 to 15 of them, and then we will keep the rest and then make her partial dentures. And she's like, okay, I want to do that. She went, so I was like, okay, I'm going to send you to the specialist, the periodontist, and they're going to check your teeth, and they're going to assess and see what teeth are okay and what teeth just are not savable. And we'll have you come back, and then we'll take out those teeth and then make you denture. Well, she went to the specialist. They cleaned her teeth every 3 months. Every 3 months on the dot, she went. 3 years later, she came back to see me. And the prescription, the specialist like, okay, I want you to pull out these teeth. And I looked at it, I was like, what? So she had all her teeth and a couple wisdom teeth. And the specialist said, just pull out those 2 wisdom teeth. That's it.
Wow.
And I was like, I don't believe this. And I looked in her mouth, I was like, what happened? She's like, I went to the specialist, got my teeth cleaned every 3 months. I went there diligently.
Wow.
And now coming back, all her teeth were strong. The bone had healed properly. None of her teeth were loose. And she gets to keep all her teeth.
Wow.
No dentures, no partial dentures. I didn't know what to say. To me, that was a dental miracle.
No
And
kidding.
so there are ways to reverse issues. Even my mother, actually, remember she actually has passed away, but during a time, she had a tooth that had a deep pocket, 8 millimeters, had an infection. You see pus coming out of there. Sorry to be graphic here, but it was loose. And I was like, oh my goodness, I gotta take this tooth out. But she was doing chemo at the time, and so I called the specialist and asked them, hey, what should I do? They're like, don't pull it out. Wait till she's done chemo and then pull it out, because that's when it's safe.
Yeah.
So for now, put her on antibiotics, clean the area, shave the tooth so it doesn't hurt for her to bite on, and then we'll wait 3 months and then take it out. Well, I saw her 6 months later. I forgot. She forgot. So I was like, oh my goodness, I have to take my mom's tooth out. I don't want it getting really bad. Well, 6 months later, I looked at the tooth. I was like, what happened? No pocket, no pus. Tooth was solid. It was back to normal. So there are things that can be done to help reverse periodontal disease,
Wow, that's good.
reverse gum disease, with proper care, proper treatment.
Wow.
So here at the Tooth Doctor, that's our focus. Is again, we want to save as many teeth as possible, as long as possible, for as cheap as possible.
I love it.
Yeah.
Great. That's a great mission. So thank you so much for joining us, and thanks for all those great facts about gum disease and periodontal disease. And don't forget to subscribe to the Tooth Doctor channel and give us a comment or a like. This was actually a great video. Lots of great information, and miracles do happen.
Yes.
Thanks for joining us. Bye.
Bye.